All right, everybody, let's look at the case of Amy. So here you go. If you want to take a second, put it on pause, take a snapshot of the screen to go along with me, you can do that right now. Okay, so let's get going. This is Amy. She's 38, and right off the bat, it's interesting. It says she's a worrier. So this very quickly, right out the get go, lets us know that worry, other words such as stress, anxiety, nervousness, all of those immediately kind of point us in the direction of at least considering some form of anxiety disorder. There also, with worry, we could consider disorders in the realm of maybe paranoia, delusional disorder. Certainly, that is not out of the realm of possibility when people are concerned about worry. However, right out of the gate, when we're hearing that word, this is at least should head us in that direction of considering some sort of anxiety disorder. So let's get started here. It says that she's a worrier, and then it goes on to say that she is restless, irritable, and has difficulty concentrating. So those three terms right there are classic anxiety-esque type of terms where a person is restless, they're irritable, and having difficulty concentrating. That in many ways, that's kind of the criteria right there for a pretty typical anxiety disorder, and more specifically, kind of somewhat narrowing things down to kind of a generalized anxiety disorder where there's a restlessness about them. They just cannot kind of settle down. They're always always on edge, always worrying or anxious or nervous. The irritability typically is because these clients are not getting a lot of sleep. Their nerve endings and physiologically they're just not calming down, and so any little thing can begin to kind of set them off or make them agitated or irritable. Another thing is that oftentimes with anxiety, there's that sense of wanting to know what's next and having a sense of structure and knowing what to anticipate. And so if anybody comes and kind of seemingly puts another problem on them or brings up another issue or something else, that then can actually cause an irritation and worry, but more so even irritation, because that's all they need is one more thing to worry about. So that irritability is pretty frequent. And then finally, difficulty concentrating. Usually this is involved because the human mind is not very good at maintaining two thoughts simultaneously. In fact, it's kind of, as we know, usually one thought is about all that the mind can handle. And so when we're talking about anxiety, typically that anxiety is taking up that space in the mind. And so, to remember where you put your keys or specific information that you're trying to remember, that becomes awful difficult when your mind is so kind of occupied and with anxious thoughts and worry that those little kind of skills that we take for granted or we barely even notice, such as where did I set my keys and other things, those with anxiety have a very difficult time concentrating and remembering such things as that, where they put things, dates, information. Those who suffer from generalized anxiety in a workplace or other setting really have difficulty concentrating on kind of what they're doing, small detailed steps. So it becomes very difficult for these individuals to work in jobs that are kind of high stress or high pressure and require detailed oriented thoughts. So there we go. Amy's suffering a worrier, restless, irritable, difficulty concentrating. So let's continue on. Interestingly enough, it says she worries that she worries so much. And this is a kind of a classic phrase when we're talking about, especially if it's leaning towards generalized anxiety, which is kind of what this looks like and has that feel of she worries about worrying so much. That kind of lends itself to this broad general anxiety as opposed to a specific sort of, and let's go ahead and go down the list, a specific phobia or an agoraphobia or separation anxiety disorder, panic disorder. We haven't run into those symptoms yet. And so that phrase, worry that she worries so much, really kind of helps us understand this is really kind of generalized worry. So let's keep that in mind, especially as we move ahead, that she worries so much. This really speaks to kind of general worry. Okay, let's move along. So, let's see. She goes on to say it and isn't always sure what it is that she's worried about. So I guess I should have continued on. So this really is kind of generalized. That kind of confirms what we were thinking about. She really isn't even sure what she's worried about. So that does lend itself back up to general. She's just not quite sure. It's kind of a low simmer, always kind of something below the surface to worry about or be concerned about. And this is really a good description. I've seen this throughout my career, day in and day out, throughout the years. And that's a pretty good description, is they just sometimes can't even quite pin it down. Or it's just everything. It's a little bit of everything piled up. All right, she can't let her husband or children leave the house without making them call regularly to reassure that they're okay. So let's identify this. This symptom right here gets a little bit trickier because it lends itself to one kind of potentially another diagnosis. But as we read this statement a little bit more detailed, it kind of reels us back in. So it says that she can't let her husband or children leave the house without making them call to reassure her. So it may have sounded right at the beginning or right at that statement that we were talking about potentially separation anxiety disorder. However, if we really kind of examine and dissect that sentence, it's not that she didn't or couldn't let them leave and that there was a fear about them leaving. It was more so she can't let her husband or children go without making them call to reassure her. So that's a little bit different than separation anxiety. It is more of a general worry of what's, making sure they reassure her of where they're at and what they're doing. Separation anxiety would more so indicate that she fears them even leaving the house. So for me, that's kind of the differentiation there. But that statement can be a little tricky. It kind of a little bit of a red herring as it sends us off in maybe a direction. Let's keep going here. Her husband's growing weary. Let me highlight that in a different color here. Husband's growing weary of her fretting, and her children can't understand what all the fuss is about. So why is this sentence included? If we take a step back, this actually lets us know, if we're looking at differential diagnosis, that this is now extended into impacting her family and the way her interpersonal relationships. That's really kind of what that sentence is saying. It may sound a little bit petty, like our husband's, growing weary of her fretting and her kids can't understand what the fuss is about. But what that really speaks to is that it's having an impact on the relationship. He's growing weary, right? And then the kids can't understand what the fuss is about. So it's now impacting her relationship with her husband. It's impacting the family relationship. It almost gets her worked up about kind of why she's even worrying. In fact, it even says down below there that their impatience with her only makes her worry more. And typically that's part of the generalized anxiety, is that they almost feel in some ways that they're kind of going crazy, or their people are telling them, oh, you're worrying about nothing, get over it, move past it, and let it go. That actually causes or tends to cause them to have much more anxiety because they can't let it go. And that is frustrating. That's what causes much of the kind of to have it become even more severe, is they start to fight against that anxiety for fear they're kind of either going crazy or people are telling them it's nothing. And you would think then that actually that kind of makes them feel guilty or shamed that they are having anxiety about these things and they can't let it go. And so it almost reinforces the fact that they're either not strong enough, they're not kind of disciplined enough, or have enough motivation or power to just get it out of their lives, so it ends up kind of snowballing. So that is the scenario with Amy. If we look back at the differential diagnoses and kind of see, generally speaking, there's really not anything out of the ordinary. She's not hearing voices. There are no mentions of substance abuse going on here. It doesn't say that she has any medical condition or that there's some sort of medical condition even possible. So we've ruled out kind of the first three major steps. It doesn't show that she's malingering. There's nothing that she's trying to obtain, or that for some reason it's a factitious disorder. So we've nailed, or we've kind of got out of the first three, kind of pinned those down. The primary diagnosis at this point, it's worry about worry. It's really kind of generalized. There's really nothing specific. And so I'm going to put down at this point that it's generalized anxiety disorder. So the good old abbreviation GAD. Let's see. What else? There's really not much more with this. It doesn't show any sort of adjustment period or adjustment disorder, so we can kind of take that off the table. There's really no PTSD, no traumatic event that would have said that this is some long-lasting or long-standing anxiety because of a traumatic event, so that's kind of off the table as well. And it appears there's enough there for sure as far as a diagnosis of generalized anxiety. The one thing that it's missing in this scenario that's curious, but this again is kind of where definitely clinical judgment comes in, and that has to do with a time frame of 6 months at least for generalized anxiety. That's something that we don't see here. All that we know is that the husband's growing weary of it and the children can't stand it. And so we kind of have to go out on a limb. It also says she's age 38 and she's a worrier. So those type of statements, the husband growing weary, the children, and at the very beginning with her being labeled as kind of a worrier, my suspicion as a clinician is likely this is not an acute incident. This isn't something that likely would have been mentioned in the case scenario if this were just all of a sudden happening to her at age 38. But it sounds like she's long been a worrier. This has worn on her relationship. And so I'm going to chalk up that it's definitely been kind of greater than 6 months for sure. So let's see. And that, again, this is based on clinical judgment. It doesn't say it specifically, but are there indications that this has been something long-standing? For me, I would say yes, and I would move ahead with that generalized anxiety disorder as the diagnosis. I would definitely refer this person, for those who have, it's been a long-standing issue in their lives, I commonly refer those with generalized anxiety disorder to have an evaluation with their medical provider. That's very appropriate. Some of these people can do very well on medications, SSRIs, and other medications to help with the anxiety. In fact, it can really shift the flow and really kind of flow of energy and the nervousness and the worry, and really kind of calm that down to the point where it becomes much more manageable. They can start to function and do well in their life. They still might feel some anxiety, but it's not near as much. They can use the cognitive behavioral skills or cognitive therapies under that umbrella. Those work very well for generalized anxiety disorder. ACT therapy, even some DBT type of skills can do very well. That's what would be my approach for this particular disorder, and that is the case scenario of Amy.